Welcome to Inspiring Business with your host, Mark Bullock, who is the co-founder of videosocials.net and of videointerviewpodcast.com. In every episode, Mark interviews business and organizational thought leaders who share their stories of how they inspire others by making a difference. You can find this show on videosocials.net and YouTube, LinkedIn, Facebook, and almost any podcast platform of your choosing.
Welcome, and I'm really pleased today to have joining me my friend and a Video Socials veteran, and he's also known in the field of health insurance as the Savant, Kenneth Wright. Welcome, Ken. How are you?
Thank you, Mark. I'm doing great. Glad to be here today.
Absolutely. And as we talked about before opening the show, I always like to start, with what's your story? What's the background? How did you become, and why did you become the insurance savant?
Yeah, it really is kind of a varied path. It isn't something I grew up wanting to do. So I wasn't like, boy, I can't wait to be a health insurance guy. I stumbled into it. I guess to make the story as short as I can is I had gone to business school, had some student loans, had been in advertising. And then when I left all that, I needed to find a way to pay off those student loans. So I went to work with a doctor in Manhattan that was looking to build his practice. And I helped him set up events in corporations. And the only events he wanted to go to were events where he could see the people. So they had to have the right kind of insurance. And that was really my beginning of learning about insurance and how it works. What are the best types of plans, which ones have the best doctors in them, so on and so forth. And that was really the beginning steps of my work in the insurance industry from a very tangential, point. As that business grew and I learned more about health coverages, the idea of wellness in the workplace became prominent. This is back in the 90s, early 2000s. And then I was approached by an insurance broker that wanted to buy my company. So I sold my company to him. And then after I did that, I learned even more about insurance from the corporate side. What type of plans are best for companies, what the employees like the most or whatever. So that was that. And I did my employment contract. I did my dues with that new company. And as oftentimes happens, after you spend a bunch of time with somebody who buys you, they want you to do something else, or they really want you gone so they can take all the money that you're now getting paid. So that happened, and then I made another jump. And then when I came out of the other jump, I said, well, what do I want to do? What do I know a lot about? And it was health insurance. So I put up my shingle again, and I launched a new business in Miami, and that's it.
Terrific. And as pretty much every guest that I've worked with, we all have a winding path that ends up bringing us to what we do. And I've seen you in Video Socials, record many videos for your social media and your website, etc. And it's pretty amazing how intricate the field is, and how really it's like there's so many people that don't understand even just some of the basics that are going on behind the scenes. It can make such a difference.
Well, I was going to say that the biggest thing, Mark, that I find that people don't understand is what insurance really is, right? And just the concept of health insurance.
Well, why don't we go there?
Most people believe that health insurance should be health coverage. And what I mean by that is they think because I pay my premium, I should be able to do anything I want and it shouldn't cost me anything, right? And so I should go to the doctor and it should be free. I should get tested, it should be free. I'm paying all this money, but, when I go to the doctor or I go get a test, it's costing me money, and that upsets me. Well, that's not insurance. Something that's going to pay for ongoing stuff is not insurance. That's a care program.
Right.
And the plans we have today, for the most part, are not at all care plans. They are coverage plans, meaning they are there to you if things get really gnarly and you end up having to potentially owe a lot of money. It's the same thing as car insurance. Car insurance isn't there to get your tires rotated or get a tune-up. It's there if you smash up your car and you might end up with a $10,000 bill, right? And that's kind of the same thing
Right.
as our insurance is there. So in case we smash up our body and end up with a $10,000 or $15,000 bill, our costs are going to be limited. And the best part about health insurance is that all plans have a max out of pocket. So no matter what happens, you're only going to be stuck for the amount of money that you are willing to risk in your out of pocket. So you could have $1 million charge and you're only going to pay $10,000. So that's really what health insurance is. But I can't tell you how many people come back to me all the time and say, how come my plan isn't paying for this? My response is, it wasn't built that way. And if you would have listened to me when we discussed it, you would have realized that wouldn't have paid for that.
I had never even myself even considered that distinction, and just a little bit of a personal story. I mean, wife and I lived in Hawaii for 20 years, and during that time we were members of Kaiser, and Kaiser was in Hawaii, 20 years ago, was a health care program, and so we got very used to, and it was, in comparison to today's insurance rates, it was fractional in cost. And so, we had the whole family on for a few $100 a month, and they did cover everything.
Yeah.
And including a lot of preventative stuff, et cetera, et cetera. So, we got used to that, and it's been a very rude awakening moving to the East Coast, getting off of a care plan and onto an insurance plan, and watching the rates skyrocket. So I know one of the things that you wanted to discuss was, what is one thing that each person that is listening to this podcast or watching it can do to reduce their healthcare costs this year?
Well, I would say that the one thing that everyone can do is make sure that you have the right kind of plan for your needs. And what I mean by that is people with chronic conditions have other needs than people that are healthy.
Yeah.
So if you have a chronic condition and you're needing to go to see the doctor in an ongoing way, you should build a plan that supports that. And what I mean by that is, so if you have a $2,000 deductible, you know that after that deductible is met, that all of your out-of-pocket costs will be met in some respects, right? Not completely, but in some respects. Whereas if you're a healthy person who never goes to see the doctor, there's no reason to spend that extra $300 a month in premiums. That's going to cost you $3,600 for the year if you're only going to see the doctor once or twice.
Right.
And that's what people have. And again, it's not a perfect science, right? Things do happen, right? The person that was really healthy might have something happen, right? But that's why you also want to build your plan. There are some other things you can do to reduce your risk and your out-of-pocket costs, but that's something that you'll need to discuss with your insurance professional. But to be just really basic, if you're healthy, the lowest deductible and the lowest premium and the highest deductible probably makes the most sense.
Right.
And if you have a chronic condition where you have to seek ongoing care, then in most cases, a lower deductible and a higher premium will probably make sense for you. But you'll notice I sound very lawyerly about that, probably because each situation really is individual. And that's the other thing that is difficult for most people to understand is if you ever go on the marketplace and look for health coverage, you're going to see hundreds of plans. And the question is, which one makes the most sense for me or for you or for your family? and it isn't easy. And people spend more time trying to decide what kind of cereal they're going to buy than they do what kind of health plan they're going to buy.
I think this is probably the best time to mention how to reach you, because I know that you do, a no-fee consult. I'm aware of a number of people that have had conversations with you. Some you could directly help. Others you could just advise and give some direction for. And I really want to acknowledge you for being willing to do that, because it doesn't matter who you are, what your experience is. When you're going into, as you say, you're going into look at health insurance, the options are seemingly endless, and knowing what is best in your particular circumstance is I was going to ask you why you're known as the insurance savant, but that's basically it. You're aware of all of this stuff, and you help guide people through exactly what you're talking about, which is, what is your circumstance? What is your situation? What do you anticipate, you're going to be needing? And then we have to, you have to, of course, look at, risk mitigation. It's like, if you're in a high risk of injury, that kind of thing.
And the other piece of it, Mark, that I think is critically important too, which is a lot of insurance agents never answer their phone from clients. As a matter of fact, a lot of people that have insurance agents never speak to them except the day they buy their policy.
Right.
And I'll tell you right now, anybody can sell you an insurance policy.
Right.
I mean, it's again, I would say that choice of policy is important, but even more important is how do you use that policy, right? Once you have it, are you going to the right facilities? What are you doing for the doctors in your network? What are your options? And to have someone you can call, or if a bill comes in, I had someone call me that had gotten a $20,000 bill because she had been in the hospital a day post delivery. So she had a $20,000 bill. And she said, this hospital sent me this bill. I said, well, you're covered for that. She goes, but it sent it to me. I said, the reason they sent it to you is because they want to get paid. And they don't want to wait for the insurance company to figure out how much they're going to pay it. So just call the hospital and tell them, hey, listen, I got this bill from you, but it hasn't been processed yet. So she did that. And the woman said, oh, yeah, we always do that. We just want to see who's going to pay us. So it's just
so I've had that experience, multiple.
We just want to see who will pay us.
we were, we were taking care of Mom the last 5 years of her life. She passed last year. But it was just standard. I mean, at one point she got COVID. She had, she in a bad way for a while, and then had to go to a rehabilitation facility for a month after the hospital and everything else. And we got massive bills coming in, and it's like, I know she's covered for all of this, and so, and then, so I would call administrators and stuff like that. And they didn't admit what your other client talked about. They didn't say, oh, we just do that as practice. They said, oh no, you're on the hook for this bill. Medicaid or Medicare is not going to cover this, et cetera, et cetera. It's like, no, they will. And if they won't, we'll deal with it. The way that I looked at it was, we'll deal with that a few months from now after everything gets processed and stuff like that. And sure enough, almost all of it ended up being covered. So I could pull up
a bill I have right now from Miami Health Center, and I could show it to you. And it says client cost underneath. It says insurance, portion, and it's been zero on the last 3 bills I've gotten from them. And each time I've called them up and I said, oh, it hasn't been, I don't know why it hasn't been processed yet. Let me check to make sure all your stuff is accurate. And I'm like, you sent me that same bill 3 times without having it be processed. I'm not going to pay it.
Right.
And the problem is that is just a waste of my time. It's a waste of everyone's time. But the problem is most people get scared
Right.
and they pay those bills. So again, just to make with let's just throw that example out, but there's a lot of things that are similar to that where people just are unsure of what they should do. And my job begins when a policy is sold. I mean, I really see it that way. It is a little more time consuming, but that's really, you asked about why. I mean, that's really why I do this. And of course, I want to make a buck. I'm not going to lie, right? I want to make a buck. I mean, everybody wants to make a buck. But I want to make a buck and have people feel like they're getting what they need. That
Right.
there's too much stuff going on. And if I can help someone out in this area, I feel good about it. I feel like that's really the right thing. The one thing I left out was between my time in advertising and my time starting this other business, I spent a year in prayer and service. So I was in a monastery and lived in a religious community and ended up getting a master's in religion.
Wow.
Now, again, I'm not here to thump any Bibles for anybody, but what all I want to say is that, I mean, part of how I see the world is through that lens, right? That we're servants and we're here to really help people the best that we can. And people are going to say, and I know that people are going to think that it's crazy, but I think that health insurance and life insurance is a way to do that, to really serve people. If those tools are used appropriately, people need this stuff. And they're scared of all of it.
Yeah, that's it. Because what are we scared of? We're scared because we don't know, right? We're lacking the knowledge. We're lacking the understanding. In many cases, we're lacking specific knowledge in a specific context, right? So as you talked about before, if you're healthy and you're young and you don't have a high risk job or whatever the case may be, you're going to be looking at a completely different policy, than somebody who is, as you say, has a chronic condition or something like that, where that they need the regular care. And so
Somebody our age, you mean? Is that what you're trying to say? Somebody our age?
Yeah, somebody our age, especially with and everybody's got families with all kinds of different things going on. But my wife has some things. I carry injuries from military, etc. So there's a lot to take into account. And before I forget, so your website is theinsurancesavant.com. You have a book appointment right on there to have a conversation with you, and I encourage anyone to do it if you're looking at making a change to your policy, you don't understand something. I know many people who've talked to you, Ken. You know your stuff, and you approach it from a service perspective, and I very much appreciate that. But almost any social media, you're on Alignable, you're on LinkedIn, you're on Facebook, you've got a YouTube channel. More about that in a moment. Twitter and Instagram, and folks, we'll have links to this all in the show notes for however you're consuming it, so you don't have to memorize it all. But I did want to touch on your YouTube channel just a little bit, because we are self-sponsored for this podcast, and you've been a member of videosocials.net for a few years now.
Oh yeah,
and you've done a bunch of videos, and every one of them, folks, is designed to be helpful. To it's not this buy from me, the typical stuff that you see out there. This is really important, sometimes very relevant to and timely to changes in insurance laws and things like that you've come out with. But I've never seen you record a video that I didn't find valuable. So please go to Ken's YouTube channel, which is The Insurance Savant, or at The Insurance Savant, and subscribe, because you do this as a public service, and I really appreciate it.
Yeah, I want to give you just a really quick little story which happened to my family members, which is they went in to see the dentist last week, and they got treated, both my niece, who's 28, and my mother, who's 94. And as they left, the receptionist said, "Oh, by the way, we don't take that insurance anymore that you have." and this is what you're going to owe. So I was talking to my mom. I said, you don't owe them anything. You owe them the contracted rate with that insurance company, because they did not beforehand, they didn't verify your insurance. They didn't confirm it with you. And then they said, oh, we sent a letter out to people. You can't do that. You can't just, that's called surprise billing in some respects. And that's a federal law. Now, if you walk in there, you've given them your insurance, that's not up to you to say whether that insurance is good for them or not. They're supposed to let you know whether they're okay with it or not. And, so that kind of stuff happens again all the time. And I would say that in those scenarios, there's a large percentage of the people that just say, okay, my bad, I'm going to pay it.
I think it's a very large percentage. Now, I live in New York, and we don't like being taken advantage of in New York.
No, not at all.
It's a little bit different here, but I think somebody in the Midwest, or they're just middle of the country somewhere. They're not surrounded by people like I am, with people who are pride themselves on being the deal finders. And like I said, I've had it happen so many times that a bill comes in and I know darn well that it's covered, or it's almost completely covered. Maybe there's some deductible or whatever, but it's like it's crazy to think. And if I didn't know that, and I just paid the bill, good luck getting it back.
Yeah. So there's one thing I did want to put out there, because we had been talking about deductibles in the past, and no, deductibles are not going to go down. Deductibles will continue to grow.
Right.
And what the idea behind that is, they call it consumerism, where the idea is that you're going to decide for yourself whether you want to spend that money or not. So the bummer is, for some people, they will avoid health care because they don't want to incur that cost.
Right.
And that really is tragic, but that's what it's ended up doing, rather than making the person, and it does make the person a more conscious shopper, right? They're not just going out and seeing the doctor 15 times. They're making sure they really need this stuff. But what people have to understand is that there are ways to reduce, and in some cases, eliminate your deductibles. So if you work for a company, talk to them about getting a gap plan. Gap plans are incredible. They don't cost that much more, $100 a month maybe. And oftentimes those gap plans can cover the deductible or any out-of-pocket costs you have on a corporate plan.
Can we spend a minute? Yeah, can we spend a moment and talk about what is a gap plan and how?
Well, that's exactly. I mean, again, what a gap plan is, it's between what your coverage will pay and what you're supposed to pay. So it will fill in that gap. So if you have a $500 test, it will pay for that $500 test. If you have, whatever it is, lab tests, it'll pay for the balance of the money that the lab test is. Now, they're all different, but in general, that's what the gap plan is supposed to do. Right, pay for those expenses.
Yep.
And I like I said, those are not available in the private market. But what we have available in the private market are plans that offer similar benefits. They're not quite as rich, but it might be something where you have a $5,000 deductible or a $10,000 deductible. So you buy a plan that will cover that deductible for any accident. So if you have to have an MRI because of an accident, it'll be paid for. If you have to have an MRI because you have a headache, it won't be paid for.
Right.
They'll cover it for an accident. They'll cover it for hospitalization. So let's just say you end up in the hospital and you have that $10,000 deductible. You're not going to have it anymore. It's going to go away. Or if you have a critical illness, so you have a heart attack or a stroke or something like that. So that's not quite as rich. So it covers those three areas. So it's not quite as rich as covering everything, but for a nominal cost, I always recommend people take a look at some way to offset their deductible. Hey, listen, if I have some clients that have 20,000 deductibles because they're rolling in the dough. It doesn't
Mhm.
matter to them if it costs them $20,000. But the average person that I work with,
Right.
having to pay an extra $10,000 it hurts.
It hurts and or can be devastating, right? So
Yeah.
no question about it. And I don't want to use any name brands or anything like that, but my wife has I don't know what they call the type of insurance, but basically, if she incurs an expense, she has some ongoing conditions. If she incurs some expense that goes against the deductible and or is quote copay, she gets reimbursed a good portion of that.
That's great.
Yeah, so there's and it's really kind of minimal cost in comparison to what it ends up paying, which is I find kind of fascinating. And it seems that that's a rarity in the insurance world anymore. Like to pay less in premium than you're receiving.
Well, I had someone call me 2 days ago that has to have eye surgery, or he just had retinal attachment surgery, but he has to have another procedure. He doesn't have any insurance, so now he wants insurance. And I said, no company is going to cover that. Nobody's going to let you pay $500 a month for something that's going to cost $15,000. Just not. Now, if we were at open enrollment, meaning for Obamacare, if he had what they call a life qualifying event, meaning that he had changed his job or added a family member and he'd been previously insured, then you can get on one of the marketplace or Obamacare plans, which cover people no matter what. You could have stage 4 cancer and still get that plan tomorrow. But most plans out there, unless they are those types of plans or a workplace plan, will not cover pre-existing conditions for exactly the reason that you said, Mark, because you're walking in there and you're spending, $300 a month, and they know right off the bat you're going to have a $10,000 charge. Nobody could stay in business that way.
Right. What other wonderful suggestions would you give somebody for whatever their situation? But if they're facing a crisis or they're really seeing, I don't understand this.
Well, there are groups out there called health advocates, and health advocates are great tools. And I think there's a National Health Advocate Association or something like that. And what their job is to help you make sure that the insurance company is giving you the coverage they said they would give you. There is a cost for that. But for a lot of people, if you're going into a major surgery of some sort, if you know that someone has to have open heart surgery, or they know they have to have some type of major procedure, or that they've just been diagnosed with a major illness of some sort, cancer or leukemia, that's progressed. Sometimes it makes sense to get one of those advocates up front and work with them to make sure that you know what you're walking into.
Right.
And there is a cost, but for your peace of mind and for just your knowledge, I think that they're worth their weight in gold. I just think that they provide an incredible service. And I would highly advocate, again, this is something you should do before you end up with that big stack of bills and say, what am I supposed to do? Of course, that's also a time you might need one if you don't have a good agent, but to do it, to be proactive, makes a lot of sense. So I would definitely say people should consider that. The other thing I hear a lot of times, is that, well, I just want to make sure my kid has good. That's what's important to me. That my children are taken care of. And my response always is, when you're on the plane, and that they say, put on your oxygen mask. Who gets the oxygen mask first? You might love your kid, but unless you get your oxygen mask on first, that kid might not end up with a parent, or that kid might not end up with, someone that can take care of them. And it's the same thing with insurance.
Right.
you need to make sure you have the best insurance possible, the best health insurance, the best life insurance to take care of your family. You are the one that's important. Now, I'm not saying you don't want to take care of your kid, but if you have to, you can take care of your kid, but your kid can never take care of you. So if you don't have the right health insurance and something happens to you, he or she's not going to go out and get a job to pay for your medical costs. And when you end up with a $50,000 bill and you get kicked out of your home or whatever, he or she's going with you,
Right.
you know, or going into foster care. And I don't want to be scary like that, but that's the truth. People
Right.
have to understand that the primary breadwinners, the primary income derivers, the primary parent or whatever guardian, those are the ones who need to make sure that they are taken care of so they can provide care to their children and their charges.
Take care of yourself so that you can take care of those that depend on you.
Yeah, and again, I understand the altruistic concept, right? The mother bear, papa bear kind of way of doing it. But you know, I'm telling you, those bears are eating their berries first before they give them to their little guys. They're not saying you're going to get all these berries and I'm not going to get any. They're catching their own fish first, and then they're sharing the leftovers with little ones if they're lucky. You know.
Well, and as of today, it doesn't even really come down so much to if they're lucky. It's like, yes, you need to take care of your children, but if you're not taking care of yourself, you're not able to take care of your children.
Exactly.
Right. So it is being altruistic. It is being a great parent, a great guardian. If you recognize how important you are to them, and so you need to make sure that as you said, you've got the right kind of health insurance. You take care of yourself, etc. So
yeah, and that again those are probably, you know, that's probably one of the biggest things I run into. I run into that every week or so. Somebody who'll throw that out, and some people will listen, and some people won't.
right.
You know, the other thing I run into is, and this is interesting. I had a conversation with someone a few weeks ago that wanted to get insurance, and he was really he couldn't qualify. What I recommend for anybody is a minimum of $1 million worth of coverage for annually. I recommend that. Well, this guy couldn't afford it, and he taught me a lesson, because he ended up buying a policy that was only allowed $100,000 in coverage. Which, if something happens to you, that's gone in a week or 4 or 5 days. But what he said to me, and I found this really, you know, it was eye-opening. Not eye-opening. I mean, again, I could say it, but I really appreciate what was to say to him. He says, listen, this is all I can afford right now. And $100,000 of coverage is $100,000 more coverage than I had before we spoke. So, you know what? It opened up. Now, again, I would never advocate for that, because I feel that it's really, really uninsured. But, you know, if that's what you can get, maybe that is the right thing to do.
I would go so far as, because I've been there, you know, a couple of times in my life where it's like, okay, I can afford what I can afford. And the fact of the matter is if it goes over that, I don't have anything for them to take. So I'm going to be filing bankruptcy anyway.
Yeah.
And you know, I hate to put it that way, but you know, we do have bankruptcy laws that, you know, are there for that purpose. And as I understand it, fortunately, I haven't had to take advantage of it. But as I understand it, a lot of people that file bankruptcy, it's because of medical bills.
Yeah, I don't want to throw out a random number, but I'm going to. But I've heard, I seem to remember something like 70 to 75% of all personal bankruptcies are medical cost related.
Right.
It just is. It's so easy to run up a large medical bill, whether it's fair or not. Oh, the other thing I want to say, that, and this is helpful for some people out there, which is you can get free health coverage. And what I mean, not coverage, but free health care. The not-for-profit systems and hospitals are set up in your area are not-for-profit because they have agreed with the federal government to get some tax breaks because they'll provide a certain percentage of charity care.
Mm-hmm.
So by law, they have to provide a certain amount of charity care. So if you ever find and I know that it's, if it's an emergency, it's hard to figure out where you're going to end up and blah, blah, blah. But just keep that in mind, is that if you really are unable to pay and you really do qualify for charity care, and you would find out only from that hospital, not-for-profits have to provide that. So you're not SOL, right? There are things out there. We do have a significant safety net if you know where to find it and you know how to use it. And again, it's the same thing with insurance. A lot of people just don't know what to do or where to go when things happen.
So why don't we? Time's running on, and we literally could go on all day, Ken. But I think that's a really good place to wrap up. And when in doubt, folks, watch Ken's videos, connect with him on social media, reach out to him to ask him a question. Everybody that I know that knows you or has worked with you is, has always been appreciative of the fact that you're willing to share this information with anybody who needs it. So thank you, my friend, and thank you for.
Oh wow, we went a long time. I didn't realize.
We
thought this long.
Not been a great host here because I've lost track of time, but
I did too. I'm completely all right. Well, listen, Mark, thanks for having me. And again, I'll make a little. Listen, I've been doing video socials with Mark for years now, and I think that one of the things I'll say, besides the videos, and I think the videos are critically important, and I've gotten some people responding to my videos, it's helped me be a better insurance agent, because it's made me think of things that I think people need to think about. So it's made me think of things and figure out answers to questions that I've had. So it's forced me, I'm not going to say allowed me, it's forced me to educate myself in an ongoing way so I can stay up, so that when I do a video, it has some meat to it. So there's a lot of reasons to do video social. Of course, one way is to get, a video blog out there and be seen and to be known. But the other thing is it really does force you to do some work. If you're going to be good at it, it forces you to do some work. And I think that that's been really, really extremely helpful for me. So thanks.
And thank you very much. And I'm glad that it's working for you. And again, thank you for coming on today. Thank you for being of service as you are to.
You're welcome.
To those that need your help. And with that, we'll close up. Thanks, everybody.
You've been listening to Inspiring Business with your host, Mark Bullock. Your positive comments, likes, and most importantly, your sharing of this show with others is greatly appreciated. Don't forget to subscribe to the Inspiring Business Podcast on whatever platform you prefer. You can catch prior episodes on videosocials.net and on YouTube, LinkedIn, Facebook, and all the major podcast platforms.